The following Health Matters segment is sponsored by HMG. Well, age is not one of those things that most of us like to talk about, but aging gracefully is something that should be celebrated. So what's your plan? Do you have a plan when it comes to aging? This evening in our Health Matters, we talk with HMG Geriatrician Dr. Ronna to get some tips on healthy aging. And remember, it's never too late or too early for that matter to get started on good health. This group of seniors knows how important it is to keep their bodies moving. Aging is inevitable, but doing it well takes practice and a plan.
One of the first systems that we see affected in most healthy older adults is the musculoskeletal system. So, my patients, unfortunately, if we don't do activity to try to counteract that, what I see is loss of agility, imbalance, frailty, and increased risk of falls.
Being physically active can make a big difference, but Dr. New says that's just part of it.
I tend to think of things really in the realms of mind, body, and spirit. So I encourage my patients to try to stay active with their mind as they age.
And that can mean taking a fun class or reading a book.
So we know that there's a lot of evidence that shows that the more we continue to learn as we get older, even if we don't retain that information as long as we did before, actually helps preserve our memory.
And of course, doing things together, staying socially active and involved keeps your spirits up and your heart happy. As a geriatrician, Dr. New begins working with people around the age of 65, helping them develop and maintain a plan.
And my number one goal for all of my patients is whatever their goal is. And I can partner with them to help them to achieve that goal. To me, that's a win. And they're happier, they tend to be healthier, and most of the time end up staying more independent as they get older, which is what most everyone wants.
Genetics and lifestyle choices both play a role in healthy aging. Granted, there are some things we can't change, but there are plenty of things we can. Proper nutrition is so important, as well as hydration. Dr. New says not enough water and oftentimes too many medications.
Sometimes over-treatment or trying to treat to too low of a level can cause more harm. We're more likely to get low blood sugars as we get older. And we're also more likely to have low blood pressures that could make us dizzy and make us fall. And what I look at is, as for my patients, I try to look at the big picture, make sure they bring all of their medicines to their visits, and that includes over-the-counters and herbals, so that I can look at those. I try to make sure there's nothing interacting, but also make sure that we have a really good reason for every medicine that they're on.
A balance of mind, body, and spirit, a partnership with goals and a plan, keeping seniors aging gracefully, happily, and independently.
So what I try to do in my practice is to partner with my patient and to look at what their family history is, what their goals are, how they want to live their older years, and how we can come up with a plan to hopefully prevent those problems and help them to continue enjoy doing the things that they really like to do.
The preceding Health Matters segment was sponsored by HMG.